Thank you. Could I please ask those members who are leaving the chamber to now do so quickly and quietly, as we will move on to the final item of business. And that is a members' business debate on motion 14806 in the name of Marie McNair on World COPD Day. And this debate will be concluded without any questions being put. I would invite those members who would wish to speak in the debate to please press the request to speak buttons. And I call on Marie McNair to open the debate. Up to 7 minutes, please.
Thank you, Presiding Officer. I am pleased to have secured this debate on World COPD Day, and I thank all my colleagues for the support in signing this motion and for participating in the debate today. I want to thank Gareth from Asthma and Lung UK Scotland for meeting with me and providing an extremely helpful briefing. I also thank Emma Harper MSP and Alexander Stewart MSP for the work they do on this matter as part of the CPG on asthma and lung health. World COPD Day takes place to raise awareness of chronic obstructive pulmonary disease. And the theme this year is Know Your Lung Function, which highlights the importance of measuring lung function, also known as spirometry. COPD is a condition that most commonly affects people who smoke or have smoked, estimated at 8 in 10 of those with the condition, but it also affects those who have been exposed to dust fumes or chemicals in work, and those who have had chest trouble or asthma in childhood. Unfortunately, Presiding Officer, I lost my own mother to COPD in 2012, so I have personal experience of this disease. And as the MSP who covers Clydebank, an area with a tragic asbestos legacy, a substance which can increase the risk of developing COPD, I feel it's my duty to speak up on this matter. Symptoms can include shortness of breath, a persistent chesty cough with phlegm, frequent chest infections and persistent wheezing. In Scotland, it is estimated that the condition affects over 140,000 people who have had a diagnosis, with tens of thousands living without a proper diagnosis. It is the third leading cause of mortality worldwide. The ageing population, along with additional complications of older COPD patients, being more likely to have other long-term conditions, presents a further challenge in managing COPD in Scotland. COPD, which includes conditions like chronic bronchitis and emphysema, affects millions of people worldwide, reduces their quality of life and ability to breathe. It can also affect your life in so many ways, with 25% stating in a recent Asthma and Lung UK Scotland survey that it affects their ability to work very often, with 39% stating it very often affects their ability to exercise. Imagine feeling out of breath getting dressed or when walking such a short distance. Unfortunately, that is a reality for many COPD sufferers. It takes away their independence and reduces their quality of life. COPD, worryingly, has a strong relationship with deprivation, with 54% of those with COPD in the recent survey having an income of less than £20,000. And this is backed up by the Scottish Public Health Observatory, which notes the rate of admissions with a diagnosis of COPD is higher for people living in the most deprived areas of Scotland and lowest for those in the least deprived areas. And unfortunately, in Clydebank, it is also tied to our shared history. Clydebank, as I already mentioned, has an unfortunate legacy of asbestos exposure from its use in the shipbuilding and engineering industries. Once titled as a miracle mineral, it was, in fact, anything but. The harmful effects of asbestos are now well known, linking it to serious respiratory conditions like asbestosis, mesothelioma, and indirectly to COPD, as exposure can increase your risks of developing the condition. This highlights an important truth about COPD. While it is strongly connected to smoking, it's not just a lifestyle disease. It can be a disease caused by occupational hazards, of neglect for workers' safety. Therefore, we must commit ourselves to action, to raising awareness of occupational hazards and push for stronger protection for workers. And in that vein, I believe the removal of asbestos from the built environment is vital. In that regard, I am sincerely grateful to Clydebank Asbestos Group for their tireless work, helping those who have been infected by asbestos. In so many ways, COPD is a silent condition, not always presenting dramatic symptoms straight away, and this is exacerbated by the barriers to diagnosis noted in Asthma and Lung UK, which noted that 23% did not know what the signs were, with 22% having the symptoms dismissed as a cough or chest infection. This is extremely concerning, as we know that early diagnosis is key. There are, however, some positives, and it was welcome to note that in the same survey it found that 39% waited only 1 month or less for diagnosis. However, for effective COPD care, we need to focus on the 5 fundamentals of care, and these are smoking cessation advice, flu and pneumococcal vaccinations, apologies for that, access to pulmonary rehabilitation, co-development of self-management plan and treatment for comorbidities. All of this is essentially to tackling COPD. But unfortunately, more must be done, as there has been a drop in the number of people receiving all 5 fundamentals of care across the UK since 2021. Asthma and Lung UK commissioned PwC to evaluate the costs and potential savings impact of 4 recommendations to improve COPD care in Scotland. There are potential savings for COPD focused on expanding the availability of spirometry to 40%, expanding the availability of pulmonary rehabilitation with referral rates at 80% and completion rates at 50%. I would be interested to know whether the Minister would be able to look further into these suggestions to ensure effective COPD care is available across the country. Each of us here can play a role. We must educate ourselves and others about the symptoms to ensure early diagnosis, encourage people to stop smoking, to push for better conditions for our workers, but we must also stand beside those living with COPD and treat them with empathy and make sure they receive the best care. Let's work together to ensure that everyone has a fair chance to live a healthy life free of COPD. Thank you.
Thank you, Ms McNair. We now move to the open debate. I call Emma Harper to be followed by Alexander Stewart. Ms Harper.
Thank you, Presiding Officer. I am pleased to be speaking in this debate this evening for World COPD Awareness Day, and I thank Marie McNair for securing this debate. And Marie McNair has covered this very well in her contribution. Raising awareness about chronic obstructive pulmonary disease, or COPD, in Scotland is important to me. In Session 5 of the Parliament, I was able to create the Lung Health Cross-Party Group and now co-convene it with colleagues Alexander Stewart and Mark Ruskell. And I'm pleased to see Alexander Stewart in chamber this evening, actually. I thank our excellent Secretariat, Gareth Brown from Asthma and Lung UK Scotland, for the continued support of the CPG and for the briefing ahead of this debate. I also thank Frank Toner and the team from Chiesi for their briefing ahead of this debate. There is so much that we could cover in COPD care, but the goal today is to shine a light on the challenges of COPD and what we can do together to make a meaningful difference. Presiding Officer, for many, the journey with COPD begins with symptoms that may be easy to dismiss: a lingering cough, shortness of breath, wheezing or chest tightness. However, as the disease progresses, these symptoms escalate, impacting mobility, independence and quality of life. Sadly, COPD is among the leading causes of hospital admissions in Scotland, placing a significant burden on our healthcare system and families alike. The exacerbations lead to hospital admissions. In Scotland, COPD accounts for about 122,000 emergency bed days annually, with an average inpatient stay lasting 4 to 8 days, with costs assessed at round about £3,000. Projected costs for COPD treatment will reach £207 million by 2030. So I was pleased to have invited one of the lung health choirs here to Parliament to sing beginning in 2018. And I'm mentioning lung health choirs because it's part of the improvement of lung function and pulmonary rehab that I will come on to. Another choir, the Chain Gang, have also sang here in Parliament. And singing is an excellent way to improve lung function. Singing teaches a person to breathe more slowly and deeply, which helps use the full lung volume. There are now 11 lung health choirs across Scotland. And in addition to improved lung function, joining a choir and participating in learning new songs, singing, meeting new people, being part of a group with shared interests also tackles isolation and improves socialisation. Presiding Officer, one of the areas COPD groups want to see supported is better diagnosis. Raising awareness about the signs and symptoms of COPD is essential to encourage people to seek medical advice sooner. Educating the public, especially those at risk, such as current and former smokers or individuals exposed to pollutants, as Marie McNair has described, can help catch the disease in its earlier stages, which then, with the interventions that come after that, can have the greatest impact. So I would ask the Minister to consider the request from Asthma and Lung Scotland to have an awareness-raising campaign for COPD. And supporting those who already are diagnosed is equally vital. And part of this means advocating for better access to pulmonary rehabilitation programmes. Pulmonary rehab programmes are health professional supervised programmes that offer a mixture of education, exercise and lifestyle support to improve muscle strength, breathing and mental well-being. PR programmes last about 6 to 8 weeks. And while originally PR was delivered face-to-face, COVID meant that PR moved into the online space and can still be delivered successfully online. So I'd be keen to hear from the Minister any update regarding the implementation of pulmonary rehab across the health boards, as was set out in the Respiratory Care Action Plan. Finally, Presiding Officer, I do need to declare an interest as a registered nurse myself, and a wee shout out to my nurse consultant sister, Dr Phyllis Murphy, who got her PhD recently. She's responsible for lobbying me to take action to create the Lung Health Cross-Party Group and for urging me to lobby the Government for a formal plan to improve respiratory care in Scotland. So I will conclude there. Thank you, Presiding Officer.
Thank you, Ms Harper. I now call Alexander Stewart to be followed by Carol Mockin. Mr Stewart.
Thank you, Presiding Officer. I'm very grateful for this opportunity to contribute to today's debate, and I thank Marie McNair for bringing this important issue to the Chamber. Ever since I was first elected to this Parliament over 8 years ago, I have sought to highlight issues of COPD and lung health more generally, and that's why I'm proud to serve as one of the co-conveners of the cross-party group, along with my colleague Emma Harper MSP. The platform that provides the opportunity to highlight the important work the organisations are carrying out on this issue, Presiding Officer. This, of course, includes the work of organisations such as Asthma and Lung UK, for whom I am proud to serve as this Parliament's smoking cessation champion. However, today's motion also seeks out the work done by small community organisations, and to that end, I would like to acknowledge the fantastic work carried out by organisations in my own region, such as Breathe Easy, Clackmannanshire. This group provides key support to those facing lung health conditions, and just last year they launched their befriending service. This allows them to support those who have been left housebound by their condition. As today's motion sets out, the theme for this year's COPD Day is Know Your Lung Function. The organisations of World CPO Day and the Global Initiative for Chronic Obstructive Lung Disease, GOLD, has highlighted the importance of measuring the lung function, Presiding Officer. This process can be an important tool to diagnose COPD. We know that there are many factors which affect lung health through a person's life, including air pollution and respiratory issues. These can include and risk the development of chronic lung disease later in life. Just as GOLD highlights, we should remember that poor lung health leads to poor health generally, Presiding Officer. This is why diagnosis and treatment of lung disease is so important. Today's motion speaks about the tens of thousands of individuals in Scotland who do have a poor diagnosis of their condition, a statistic which lays bare just how urgent this issue truly is. Research by Asthma and Lung UK have suggested that half of those with COPD cases are individuals who have yet to receive a proper diagnosis. In this respect, the publication of the Government's Respiratory Care Action Plan we welcome, but it's a much-needed step in going forward, and I'm sure the Minister will talk about that in her summing up. However, there is still a lot of work required to ensure that all 12 recommendations and commitments and plans are implemented. These include the commitment to improve access to screening for lung health problems to ensure that respiratory care is updated in line with recent sciences. Given the large number of undiagnosed cases of COPD, the work is clearly urgent, and I hope that the Scottish Government will treat this in such support. In conclusion, Presiding Officer, I would like to take this opportunity to commend the important work of organisations who strive to raise awareness of this condition. I also commend those who find themselves living with this challenging condition. And as we've heard, it really is very debilitating for these individuals. As well as raising awareness of COPD, we must continue to improve how we support those who are affected. I hope that the Government is able to take this message from today's debate and ensure that everyone suffering from this condition can access the support they truly need. Thank you.
Thank you, Mr Stewart. I now call Cara Mochan to be followed by Finlay Carson. Ms Mochan.
Thank you, Presiding Officer. And can I thank Marie McNair for bringing this important debate to the Chamber. And on behalf of Scottish Labour, I would like to welcome World COPD Day, which takes place today, and recognise this year's theme of Know Your Lung Function, as others have said. Raising awareness of COPD and the symptoms is an important part of the National Day, and I congratulate everyone involved in this success, and I thank colleagues for the briefings updating us on the situation for those who live with COPD. As we have heard, the symptoms include shortness of breath, a persistent chesty cough with phlegm, frequent chest infections and persistent wheezing. This lung disease causes restricted airflow and breathing problems, and it's a condition that most commonly affects people who smoke or have smoked, as we've heard, but also those who have been exposed to dust fumes or chemicals, and often that's in work. And those who have had chest trouble or asthma in childhood can also be affected. The prevalence of COPD in Scotland, and indeed globally, should cause all of us some concern. The condition is estimated to affect over 140,000 people in Scotland who have had a diagnosis, and that they suspect that thousands are living without a proper diagnosis as well. And COPD continues to be the third leading cause of mortality worldwide. In order to stop this worrying trend, I consider it is important that the causes are understood and highlighted, and that's part of what the World COPD Day is about. I raised this last time that I spoke on this issue in the Chamber. I want to add again that smoking is the most common cause of COPD, being the leading factor for 8 out of 10 cases. This means that many cases of COPD can be tracked back to a single cause, which highlights for the Parliament where action can be taken. And I know the Scottish Government have their plans for a smoke-free generation in 2034. And I just want to again state that I am very supportive of this and would do all that I can to support the Minister with this. Presiding Officer, we need more action now to protect those living with COPD. We have heard from those who suffer the condition some of the things that are happening for them at the moment. For the third year in a row, a recent report by COPD sufferers indicate that 5% of patients in a survey reported not receiving the important 5 pillars of care that Marie McNair had mentioned. 1 in 5 wait more than 5 years for diagnosis, and 1 in 8 more than 10 years. Real barriers exist to diagnosis, which I think are reflected in those long waits: GP misdiagnosis, difficulty getting appointments, a simple lack of awareness in communities of the signs and symptoms. The condition is also another one that disproportionately impacts the poorest in our society. In Ayrshire, where I live, the rates of COPD are among some of the highest in Scotland. And in 2018, NHS Ayrshire and Ireland had the highest proportion of people living with COPD in Scotland. So it is important to me, as the South of Scotland representative, and also living in Ayrshire, that we can take some action that supports those, of course.
Emma Harper.
Thank you, Presiding Officer. I'm wondering if Carl Mochan is aware of the work of Dr John Lockhart, who worked with the University of the West of Scotland to look at the prevalence of COPD in the southwest of Scotland and in Ireland, because there are links that seem to be coming out with the evidence that looks quite interesting in what John Lockhart has produced.
Carl Mochan.
Thank you, Presiding Officer. Yeah, actually, I think I've probably heard you speak about it before, Ms Harper, and I certainly take on board much of the points that you make and the various ways that you speak about it. And I do, like others, really appreciate all the work that you do in this area, and it's important to have these things raised in the chamber. Presiding Officer, I have a close family friend, Lillian Welsh, who suffers from this condition. And so I know how COPD impacts people's daily life, how it restricts work, social life and enjoyment of everyday activities such as walking the dog or playing with grandchildren. This is a real-life condition, and it's important this Parliament makes time to debate this. So I really do thank Marie McNair and others who have contributed to the debate for bringing what is important to our constituents into our Parliament. Thank you, Presiding Officer.
Thank you, Ms Mochan. And I call for Nick Carson. Mr Carson.
Thank you, Deputy Presiding Officer. I would also like to begin by expressing my gratitude to Marie McNair for bringing this important debate, particularly with our personal connection to this disease. COPD is a topic of great significance, particularly for the port town of Stranraer, my constituency of Galloway and West Dumfries, which has become an unexplained hotspot for COPD. Here, the condition affects 3% of the population compared to an average across the UK of 2%, earning Stranraer an unenviable title of the COPD capital of the UK. COPD continues, as we've heard, to be the third leading cause of mortality worldwide, and with an ageing population, managing this condition presents a significant challenge in Scotland. Smoking remains the primary cause, with an estimated 8 in 10 of those living with COPD having smoked or continuing to do so. Alarmingly, the latest survey by Asthma Plus Lung UK found that COPD care levels are falling for the third consecutive year, with only 5% of patients receiving the 5 fundamentals of care. Now, I know we've already heard this in the debate, but I make no apologies for repeating these concerns. These fundamentals include support to stop smoking, flu vaccines, pulmonary rehabilitation and self-management plans. Unfortunately, performance across all these elements has declined. Detection rates are also poor, with only 1 in 5 patients waiting more than 5 years for a diagnosis, and 1 in 8 waiting over 10 years from the onset of symptoms. Barriers to diagnosis include a lack of awareness of the signs, difficulties in securing appointments, and GPs initially dismissing symptoms as chest infections or coughs. It's quite clear that the financial burdens of COPD in Scotland are concerning. They're staggering, estimated to be at nearly £618 million, with my own constituency bearing a cost of over £26 million. As I said previously, Stranraer has the highest number of hospital admissions for COPD in the country, a deeply concerning statistic given its lack of heavy industry typically associated with chronic lung conditions. This disparity highlights the strong link between socio-economic factors and respiratory health outcomes in Scotland. As we've heard from Emma Harper, 4 years ago, a team of scientists and researchers led by Professor John Lockhart from the University of the West of Scotland launched the Breathe project to investigate the high prevalence of COPD in my constituency. Despite their efforts and a £7 million funding boost from the European Union, the proposal for a dedicated centre of excellence to be based in Stranraer was not realised due to a lack of funding. And this facility could have been a major asset in the fight against COPD, providing critical research and training. And while the Breathe project continues its valuable work in research and public engagement, the need for a centre of excellence remains. It's imperative that we revisit this proposal to ensure better diagnosis, care and treatment for those suffering from lung conditions. In conclusion, Deputy Presiding Officer, we must do everything in our power to improve the lives of those affected by COPD. With lung disease now one of the top 3 killers in Scotland and 1 in 5 people diagnosed with a lung condition at some points in their life, we owe it to the sufferers to provide the best possible care and support.
Thank you, Mr Carson. And I now call on Minister Jenny Minto to respond to the debate. Around 7 minutes, please.
Thank you, Presiding Officer. I too would like to thank Marie McNair for lodging this important motion and welcome the opportunity to respond on behalf of the Scottish Government. I'd also like to put on record my thanks to those supporting people living with COPD in Scotland, including our fantastic NHS staff and third sector organisations such as Asthma and Lung UK and many others. And I think it's also important to put on record the important work that the cross-party group has carried out with regard to COPD. I always think these debates are very valuable because we get real contributions from members of the Chamber, really helping to raise awareness, but also to bring it back to the person, to the people that are living with COPD. And today I was at Nine Wells Hospital this morning for a visit for another area of work, but I was really pleased as I was leaving the hospital that the Asthma and Lung UK stand was there front and centre in the foyer, giving people advice on the conditions and the symptoms that Marie McNair, Emma Harper, Carol Mochan and others talked about: shortness of breath, coughing and wheezing, chest tightness and fatigue. I'd also like to thank Marie McNair for highlighting, as Carol Mochan did as well, the importance that it's not just lifestyle, but there are also occupational reasons why people may be living with COPD. And also, Carol Mochan specifically mentioned the connections between health and deprivation. And this can be seen, as Carol Mochan indicated, from the increased number of people with COPD in areas of deprivation, as well as linked to significant reductions in life expectancy. So thank you, Carol, because I know that's Carol Mochan, that's one of the areas that you are a passionate speaker for. Emma Harper talked about the impact of COPD on our health service. An estimated 8% of hospital admissions are related to respiratory disease and 10% of bed days. And that really, to me, underlines the importance, as everybody has talked about, the importance of prevention and diagnosis. World COPD Day allows us the time to reflect on the progress made in respiratory care, as well as the challenges we face. We know that the care and treatment for COPD is not always where it needs to be. The Scottish Government is committed to improving services across the country to meet their needs through the implementation of a respiratory care action plan, as many have mentioned. The NHS Centre for Sustainable Delivery supports professionals to implement key aspects of this plan, while also working towards consistent Once for Scotland pathways in respiratory services. A current priority for this group is developing a Once for Scotland COPD pathway. The group recently conducted conversations with people living with COPD to better understand where improvements can be made, and will be working with clinical specialists from a variety of professions to develop this pathway. The theme, as many have said, of this year's World COPD Day is Know Your Lung Function. While we know that around 140,000 people in Scotland currently have a diagnosis of COPD, there are many people living with symptoms. For those already receiving treatment, a key aspect of care is pulmonary rehab. Improved access to this is one of the priorities in the Respiratory Care Action Plan, and I would like to credit the many dedicated and committed respiratory physiotherapists, nurses and other members of the multidisciplinary team that provide pulmonary rehab across Scotland. The benefits of this are very well evidenced, but we know that many people living with COPD are not able to access that support. Significant work has been done to better understand access routes in and out of these services. We also want to provide more support to people when they are inpatients and create better links to third sector support. And I would also like to commend the work of the Chain Gang and other choirs. I had the privilege last year of spending an hour or so with the Chain Gang listening and trying to sing with them. And I know Alexander Stewart has a far better voice than I have, and I was wondering if at one point you were going to give an illustration of how that can help. And I agree absolutely with Emma Harper that not only is that choir supporting lung function, it also really helps tackle isolation. Another major milestone in COPD care this year has been the publication of the Quality Prescribing Guide for Improvement. The guide aims to keep people at the centre of their treatment and promote safe, evidence-based, sustainable prescribing. The guide will ensure decision-making is shared between clinicians across the multidisciplinary team and people living with respiratory conditions. The prescribing guide has a focus on net zero. It's important to recognise the environmental impact of inhalers used for treating asthma and COPD is the equivalent of around 80,000 tonnes of CO2 a year. We want to ensure patients and their prescribing clinicians are equipped with facts to enable them to make the right choices. And as Alexander Stewart has said, and others, for those living with COPD and other lung conditions, the environmental factors play a huge role in their daily lives. Our vision is for Scotland to have the cleanest air in Europe, and we are committed to protecting people from the effects and harms of poor air quality. For example, the introduction of low-emission zones in our 4 largest cities in 2022 was a key initiative in further improving urban air quality. As Carol Mochan has said, the Scottish Government is committed to creating a tobacco-free Scotland by 2034, and I welcome the reintroduction of the UK-wide tobacco and vapes bill that will help us achieve our ambitious target. Scotland has... Yes, of course.
Emma Harper.
I thank the Minister for giving way, and I don't want to take us down a rabbit hole about vaping and young people vaping, but does the Minister agree that we should be concerned about the increased prevalence of vaping, including with young people, and its links to COPD?
Minister.
I thank Emma Harper for her intervention, and to slightly go down that rabbit hole, yes, I do agree that we have to be very aware of vaping and young people, and that's why I was very pleased that the Scottish Government had a campaign last year, or earlier this year, called Take Hold, which was working with and informing parents and carers of young people about the impact of vaping. And it's something that, having spoken to many young people, they are concerned about it as well. Scotland, I think, as I said, has a range of world-leading tobacco control measures, and smoking rates continue to decline. This suite of preventative measures will help people to better manage their condition, but also support us to prevent respiratory disease in future generations. Presiding Officer, I would like to close by reiterating our commitment to ensuring that everyone living with COPD in Scotland receives the best possible treatment, care and support. We know that there is still more to do in respiratory care, and we can improve by better understanding the needs of people living with COPD. As Marie McNair said, we need to work together to find these solutions to support people living with COPD in Scotland.
Thank you, Minister. That concludes the debate, and I close this meeting.